What we need, of course, is the patients, because they have to join and help co-create. And that's why I'm particularly happy to welcome Dr. Danner. He is the managing director of the German working group Selbsthilfe, and he has been with Selbsthilfe since 2008. It's an umbrella association of 123 small organizations, 7 professional associations. So this is at least what your homepage says. You are representing this association at the federal level, speaking on behalf of the patients. And now we hear more about the promotion of self-management and digital health literacy and how self-help can make a valuable contribution here. We're looking forward to your presentation. Well, we have already heard a number of very interesting presentations, so it's not an easy task to give another valuable impetus, but we have heard about self-help and empowerment before. I'm really looking forward to tell you more about self-management and digital health literacy related to self-help. I do not want to start out by providing another definition of self-management. However, I would like to touch upon a number of aspects that are very relevant to chronic conditions. First of all, it's self-perception. We need to promote self-perception and improve self-perception of the patients, not only regarding the needs they have due to their conditions, but also as far as their environment is concerned. So context factors of a condition are important. This is quite a complex challenge to overcome. Then we need to support their autonomy, improve their motivation to be in charge, and strengthen their self-efficacy expectations. This is supposed to be a part of self-management, strengthening their independence, and on the other hand, resourcefulness, using resources, benefiting from them. And I think these are all aspects that are part of self-help and that are key to self-help provided to people with chronic conditions. And what I would like to emphasize is that self-help is not to be considered to be an individual helping him or herself. This is about mutual exchange, strengthening each other, collecting information, and we can easily apply this to these different aspects. Self-perception. Well, of course, it is important to have this exchange with the peers and then get a better grasp of your own situation and whether this situation is different from the situation of your peers. And this will help raise awareness. Well, opposed to a course or a training, self-help can be done over a longer period of time, especially when it comes to progressive disease. Conditions sometimes change. The condition itself may change, the context may change, and self-perception can be considered and discussed again and again and needs to be adjusted. This is very similar to autonomy, because in self-help it is important to strengthen the autonomy of patients so that patients realize where they can make and where they can take decisions and where they can find help and support provided by the healthcare system. That is why self-help needs to contribute to empowerment. So it is not about being an individual facing the system. It's rather important to form a kind of team spirit, and this will change the conditions to implement self-help. So self-help can be a motivational factor in order to enable individuals to improve self-management. This is closely related to independence. So patients should be better able to plan the action they are going to take and not only to react or respond. So there are possibilities that are offered to help patients do their planning. And usually there is a focus on conditions. I would like to give you 2 examples. We have different patient associations that help patients to use special means to deal with their situation. Then there is another examples. I talked to parents of children with a chronic condition, and they have special trainings on how to deal with their children if they need a special medication or a bath. So this is what they can do in order to help individuals, because here we have a collective approach and exchange among peers, and this helps people to getting more and more independent and autonomous. And that is why INSEA is very attractive to us. It can contribute to self-help because it is a very structured approach. And we are lucky in Germany. Self-help organizations have already opened up to the INSEA program. I think it was quite interesting to hear that usually the issue is self-help is indication specific. INSEA, however, is acting across disciplines, across indications, but this applies to self-help as well. We also have a more general approach. We have associations at a federal level, and the Obama statutory health insurance is doing a great job here. So thank you, Mr. Krug. You cooked this off. And Mrs. Lorick, what I think was particularly interesting to hear was that you showed very well that INSEA can be used for specific indications. So there are already programs for diabetes, cancer, or pain patients. And this, of course, is a very interesting perspective for us as self-help organizations. So we might use these evaluated programs for specific diseases. This was very interesting. This was very interesting to hear, and I was also delighted to hear about these toolkits, because they might also be used for self-help. So we might want to develop toolkits ourselves and try them and have them evaluated so that we might benefit from them during our self-help approach. And the resources that are available to self-help can be complemented by these additional measures. So self-management is important and will add value to self-help. But then there is another important issue that I would like to address here, and that is health literacy. Well, I'm not trying to provide definitions and combine the two, but what I would like to underline is that knowledge and expertise is an important basis that enables self-management, and the relation between self-management and health literacy, of course, cannot be denied, but When it comes to self-help, well, for us it was difficult to discuss health literacy because we think that health literacy is very well defined. It's about finding, assessing and using health-related information. And we were quite shocked to hear that people with chronic conditions are part of a vulnerable group, because in the first publications, people with chronic diseases and those who are illiterate, they all seem to belong to the same group. And sometimes, especially in self-help groups, you feel that you know more about health practitioners. Let's say a person has suffered from chronic conditions for more than 30 years, then usually they have more expertise than others. And so it's quite hard to say, I'm part of a vulnerable group that is supposed to have problems with health literacy. Well, but I'm going to give an explanation. This is not a conflict, really, because we think there is a background to this. Let's say you suffer from a chronic condition, then you need to deal with very complex challenges. First of all, regarding the condition, there are context factors, contextual factors. This is about the impact on your work life, on your family life, and it's often difficult to find reliable health-related information. Let's say you need dialysis at home and you need your partner's support. This may also have an impact on your life as a couple. So this may have an impact on your relationship. And then I would like to need reliable health-related information that helps me, that I can read and assess and use. And this is exactly where self-help is needed and plays an important role. And of course, this will apply to other aspects too. This is about very complex decision-making, complex planning. Another example, let's say a manager is being told that you need to apply some lotion 3-4 times a day. Well, of course he will understand, but it's very, well, it's very hard. It's very, well, are my symptoms really getting better? Am I able to make this part of my daily routine? And what is the impact on my professional life? So this illustrates very well that you need to strike a balance here on how to define this vulnerability. What's more, we with self-help groups, we have kind of collective experience, because the manager is not the only one suffering from this disease and needing the special lotion several times a day. So we may help to develop strategies, and we can also ask patients and their consequences, their long-term consequences. So there might be a person saying, well, this lotion doesn't really help me. Maybe there are others that have similar experience and can provide help and support. These are the usual self-help strategies. But I would also like to emphasize that this, well, evidence-based strategy on how to strengthen health literacy should be part of our work. And this is what we're trying to do. There is a project, for example, where we try to provide information and material to those teaching these classes with material on health literacy, so that they can discuss this topic, taking a very hands-on approach. And that's why we are very happy that our association in North Rhine-Westphalia works with local self-help groups and in order to discuss how to deal with health literacy, in order to have a grassroots discussion. Then, of course, there is a different level, because we, as an umbrella association, we have been very committed to the Alliance for Health Literacy, literacy and an initiative launched by the Federal Ministry of Health. So we try to promote this topic, and I'm also trying to create a link here between the definitions provided by Mrs. Lorick and Mrs. Schäfer. Well, what is emotional and what is rational? Self-management or health literacy? Well, I think self-efficacy expectations are often underrated as a skill when it comes to health literacy, because health-related information can be provided in a way that self-efficacy expectations can be strengthened. You can also turn a blind eye to this topic, emotions, emotional approaches, and I think this is the strong suit of self-management. It's not only about written text, but about mutual exchange during courses or classes. And maybe this is also an opportunity for the future to bring these elements together and develop this theory further. There's another similar project that we are working on. The Health Knowledge Foundation found out that when it comes to self-efficacy expectations, people with chronic conditions are also a vulnerable group. And again, we are trying to find out whether we as a self-help group association can make an intervention here. And now I would like to get back to what Mr. Krug said. He said a lot of information that is not evidence-based in self-help, and INSEA, however, is evidence-based. But I would like to underline that there are aspects to self-help that have not been taken into consideration when discussing health literacy. That's why I put here self-help is encouraging and stabilizing. So what we tried to do was to develop evaluation criteria further, because it is a big problem. Usually people think that self-help only means providing information. However, it is often forgotten that it also helps to people to, well, stabilize and deal with their emotions. But emotionally aspects are often neglected because it's very difficult to collect information on that. So maybe this is what we can do in the future, because it is not true that self-help is not evidence-based. And I would like to wind up by talking about digital health literacy, because it is true that there is a need for action. The digitization of our healthcare system is making headway, and our patients only have very few possibilities to prepare for that in order to meet these new requirements, the requirements of a digitized healthcare system. So let's say the electronic patient file will come, then we will find out whether it's really working or if people are not able to deal with it. And this, of course, might be a problem in terms of costs. We think that this is a good idea in order to look into cooperation with the Medical University of Hanover and the Barmer Statutory Health Insurance to create more opportunities, qualification opportunities. This is what we will hear more about in the afternoon. This is a strategy that is very key to self-help. But on the other hand, I would like to get back to what I've already mentioned. One of the objectives of self-help is to make people more powerful, to have some team spirit, to take a collective approach, and to be involved in co-creation. We would like to make a valuable contribution to the digitization of our healthcare system. The design should not only be based on the idea of healthcare providers, but also on the ideas of patients. And that is why our political work is equally important. So this is what we are doing, talking about how digitization of the healthcare system comes along, because we cannot expect patients to attend more and more trainings and courses and acquiring more digital literacy, and the system is getting more and more complex. And last but not least, self-management is an important element of such digital healthcare system. Self-management is also available online. So this can be part of the communication with the digital healthcare system, but from a self-help point of view, I think this should be optional only, whether they prefer a face-to-face class or virtual exchange. During the COVID-19 pandemic, we have realized that our participants have different skills and different preferences, and this is something that we should bear in mind. Though there's a plethora of opportunities when it comes to self-management and health literacy, and I'm sure that we will have the opportunity to discuss this later on. Thank you very much.
Dankeschön, Herr Danner.
Thank you very much, Mr. Danner. You also talked about paving the way for self-management, and self-management is very important for self-help. And I believe we can use this mirroring effect that you talked about. I think health literacy can be used on every level. It's also about training. Training is also an element of self-help, which can be very useful.